Good afternoon. I'll talk more about women's health. As you know, we just talked about endometrial cancer. So now we want to talk about fibroids. This is something that a lot of African American women suffer with and suffer in silence again. We actually normalize it. Now, women of my generation, I've known friends to actually, science has advanced what can be done. And so we're glad that we're having a discussion with two health advocates who work to raise awareness of what uterine fibroids mean to African American women and how to adapt our lifestyle so that we don't normalize these irregular periods and the symptoms that fibroids bring. I want to thank Myovant for their support of this specific talk. Myovant has been a great friend to Black Health Matters, so please go and see their booth. We have today two outstanding young women who are committed to advocacy, but who mean business. Don't let their smiles fool you, because they're out to educate you about fibroids and to take no prisoners. They've launched an initiative called the White Dress Project. First, I'm going to tell you that Amber English-Coleman has her master's in public health, and she is a member of the board of directors for the White Dress Project. She earned her master's degree in public policy from Georgia State University. Second, we have Nkem, Osian. Did I pronounce it correctly?
Almost.
Right. Please correct me.
It's Nkem, Osian.
I definitely just mispronounced it.
Okay.
So I'm sorry. And a master's in public health, and she's a public health analyst for the U.S. Department of Health and Human Services. She serves as the board secretary for the White Dress Project. All right, ladies, I know that you're just going to expose everything that's going on and what we can do to help manage the sisters who have fibroids. Take care.
Thank you so much, Rosalind, for that introduction, and good afternoon, everybody. This is Fibroids Awareness Month, so we are so grateful to Rosalind and the entire Black Health Matters team for giving us the opportunity to utilize this powerful platform to highlight such an important but yet often overlooked gynecological condition that affects so many women. As Rosalind mentioned, my name is Nkem Osian, and I am a patient advocate and board member of the White Dress Project.
Hi everyone, I'm Amber English-Coleman. I am also a board member of the White Dress Project, and I just want to give my lovely sister Nkem the credit that she is due. She is the Masters of Public Health on this webinar. And I'm so grateful to be presenting with her today. So we'll go ahead and dive right in.
So what are fibroids? Fibroids are non-cancerous benign tumors that grow on the uterus. They usually develop during childbearing years, and they can develop in different locations of the uterus, and they can be all different sizes, and women can have one or several fibroids. As I mentioned, it's a really common gynecological condition that affects so many women, but it disproportionately impacts African American women, which we will get into a little bit later on in the presentation. And women with fibroids can be either asymptomatic or symptomatic, and women who are symptomatic, those symptoms can be extremely debilitating, life disrupting, and it can really significantly diminish your quality of life. So what are some of those symptoms?
Well, some of the symptoms of uterine fibroids include heavy menstrual bleeding. That's one of the telltale signs. Sometimes you have a protruding belly or feeling bloated all the time or appearing bloated, fatigue, frequent urination, and sometimes constipation, challenges with fertility, painful intercourse, menstrual periods lasting more than 1 week. So again, that heavy menstrual bleeding again, pelvic pressure or pain, and then severe anemia is usually a result of that heavy bleeding. Now, when you look at some of these symptoms, these could be symptoms of anything. So when you think about the bloating and the protruding belly, sometimes you'll hear women say, oh, I just thought I was gaining a little weight. Fatigue is very vague. And in fact, a survey that was conducted a few years ago found that women see an average of 2 physicians, or 41% of women see an average of 2 physicians before getting a correct diagnosis. And then a separate survey found that women are waiting about 3.5 years to seek treatment. So you think about 3.5 years living with symptoms like this. Part of it is because they're wading through the waters of information and treatment. So I will kick that over to Nkem.
Thank you, Amber. So there are several treatment options for women living with fibroids that fall into 3 different categories. The first category focuses on treating the symptoms. So that can be in the form of birth control, which I am currently on to manage my heavy menstrual bleeding, pain medication, and endometrial ablation, which destroys the lining of the uterus in order to either reduce menstrual flow or completely stop menstrual flow. The second category involves treating the size of fibroids. So for example, there's the Lupron injection, which over the course of several months ultimately shrinks the size of the fibroid. And Lupron falls into a class of medications known as gonadotropin releasing hormone agonists. And the last category of treatment involves removing or destroying the fibroids. So there are several surgical procedures under this category. One surgical procedure is called the uterine fibroid embolization, UFE, otherwise known as uterine artery embolization, UAE, and that involves cutting off the blood supply to the fibroid. Another surgical procedure is the myomectomy. So you can have a laparoscopic myomectomy, a hysteroscopic myomectomy, or a robotic myomectomy, and all of those are minimally invasive, which require a shorter amount of recovery time. There's also the abdominal myomectomy, which involves an open incision, a bikini cut, and that requires 6 to 8 weeks of recovery. We also have the Acessa procedure, which is a minimally invasive procedure as well. And we have, of course, the hysterectomy, which is the surgical removal of the uterus and the fibroids altogether. And it's the most definitive treatment for fibroids currently because it guarantees that the fibroids won't grow back. Now, something that I wanted to highlight regarding the treatment options is that when women are seeking treatment options, some of the things that they consider is, will this treatment preserve my fertility if you desire to have children? So there are a few on this slide that do not preserve fertility, and I just wanted to point those out. So the UFE and the UAE, in addition to the Acessa and the hysterectomy, are not fertility preserving treatments. Along those same lines, I wanted to highlight also that seeking treatment options for women with fibroids can be a pain point because of many factors. But for example, there are some doctors out there that only know how to perform 1 or 2 of these treatments, and they don't inform their patients about other treatment options that exist, which significantly limits the treatment options. And that is why at the White Dress Project, we encourage women so much we encourage women to be their own health advocate, be armed with information, and take that information to your physician so that you can work as a partner with your physician to determine the best treatment option for you.
So as Rosalind mentioned, we're here talking about Black health today, and unfortunately, Black women really bear the brunt of the uterine fibroid crisis. 80% of Black women by the age of 50 will have experienced uterine fibroids. We're also 2 to 3 times more likely to develop them at an earlier age and develop larger fibroids. As a result of this, Black women are also more likely to be hospitalized because of their fibroids. And kind of finally rounding that out, Black women are more likely to seek surgical treatment options. So that would be, again, the myomectomy, like Nkem just spoke about, to remove the actual fibroids, or a hysterectomy, which is the removal of the uterus altogether. That particularly is a pain point because we think about the history of medicine in this country and, quite frankly, medical racism in this country. And you think about a hysterectomy being a procedure that ends your chances to bear a child, if that is something that you want to do. So that is deeply painful. Black women are sometimes offered hysterectomy as the only option, when in fact it is not. Now, all of the physicians that we work with will tell you, you have to find the best option for yourself, right? And sometimes that is a particular woman's best desired option, but it is by no means the only option out there. And to be quite frank, this fact and this sensitivity has led to a lot of fear and mistrust in the system.
Right. So as Amber just mentioned, there are several barriers to care and to speaking up that keep women suffering in silence with fibroids. As Amber just mentioned, some of those factors include fear, stigma, mistrust of the medical establishment and the medical community, racism and discrimination that is so pervasive within our healthcare system, lack of information and misinformation about the condition. So all of these factors interconnect and are thrown into a bucket under this concept known as medical gaslighting. Medical gaslighting refers to when some physicians either downplay or outright dismiss a patient's symptoms, a patient's pain, and a patient's condition. And it leads patients to, question their own sanity. And it leads some physicians to perceive patients as false witnesses of their own experience. And it presents itself in the form of subtle statements made by some healthcare providers, statements such as, oh, it's all in your head. It's just stress. Take a Tylenol. You'll be fine. It's normal. This happens to all women. And because of those subtleties, sometimes we miss that we are being victimized by medical gaslighting. And it completely negates the Hippocratic oath that doctors take to become physicians, to first do no harm to patients. This puts our lives at risk, this puts our health at risk, and this puts our well-being at risk. This is why we mentioned it is so very important for us to be our own health advocate. And that doesn't just involve being informed and armed with knowledge, which are critically important as well, but it also involves being intentional about being collaborators in our care. It involves having the courage to walk away from a physician who is not providing you with the optimal treatment and care that you deserve, and seeking a second opinion. And that is what we're doing at the White Dress Project every day. We are advocating and educating to break down these barriers to care and to break down the walls of silence.
When you talk about that, I think a lot about my own experience in going through the journey of seeking treatment for fibroids. I experienced just this, and what it looked like to me in the patient room was doing everything that Nkem just talked about, arming myself with information, journaling my symptoms, and doctors would say to me, is it really that bad? Do you really need to seek treatment? Are you really in pain? Is this really changing your life? Do you think you can hold on? I'll talk a little bit more about watching and waiting later as a treatment option or a treatment suggestion. But really, it's something that happens all the time. And the second thing that we suggest, which I actually ended up having to do last year, is finding another medical provider. Don't be afraid to get a second opinion, third opinion, fourth opinion, however many you need to get the doctor that is treating you in the way that you feel is compassionate and listening to you, and really a partnership, which I think this leads us to discussing a little bit more about the White Dress Project. There we go. Discussing a little bit more about why the White Dress Project exists. We use patient education, advocacy, and storytelling to really take this conversation from behind the walls of silence out into the community, out into the world, so that hopefully we can reach a world where, number one, no woman ever has to suffer in silence with fibroids, and number two, we're getting the care that we need. I think we'll pause right here just to say if there are any questions, definitely throw them in the chat. We will answer in the best way that we know how, and with the information we've been armed with from our physician partners, but we'll get right into it. So the White Dress Project was founded in 2014 by Tanika Gray Valgren. It was founded after she had emergency surgery to remove fibroids. And it's really working towards filling the gaps, right? There's gaps in patient information, there's gaps in care, and there are tons of questions and huge gaps in research. And we do that through, education, events like this, advocacy, both locally and federally, and then finally encouraging people to share their stories.
So we implement a lot of educational programs, and we ensure that, one, our educational programs connect patients with our partner physicians, and two, that we create a safe space for women to share their stories, because we know that sharing is liberating and sharing is healing. So these are a few of the educational programs that we've implemented. Taboo Talk, which takes place every year in Houston, Texas. TN Talk, which takes place in the DC, Maryland, Virginia area. And we just completed a virtual 3-day dialogue with the doctor series last week. It was incredible. We were able to connect patients with physicians, and they were able to ask questions in a comfortable environment, questions that they would otherwise not be able to ask their own physicians due to fear and stigma that we mentioned earlier. And it was also really empowering because patients found enough courage and vulnerability to be able to share their stories with each other. And that's what we were going for. That was our goal. So House Calls is another, House Calls Instagram Live series was another educational program that we've implemented to connect patients to doctors as well. Night in White, Breaking the Walls of Silence is our signature fundraising event that takes place in DC. But we also find a way to infuse educational components to it and storytelling components to it as well. And we also, one of our focuses when it comes to education is going out into the community where women are already gathered and infusing the conversations about fibroids into the larger community conversation, thereby bringing the conversation about fibroids from behind the walls of silence out into the open. And we've been able to do that at community events such as the Essence Music Festival and the Henrietta Lacks film screening and panel discussion about women's health that took place in Atlanta. And we're really excited because we've taken our educational efforts from the community to the halls of Congress and local legislative bodies through our advocacy efforts that Amber will now talk about.
Yes, this is my favorite part of the White Dress Project work. So as with many health issues and particularly health disparities, there's a policy solution. And so too is the case with uterine fibroids. So the White Dress Project is proud to be the authors of legislation that named July Fibroid Awareness Month. We know that awareness is not the only step, but it's certainly the first step. And even in my years of being with the White Dress Project, I've noticed that each year during July, there are more people who are engaged in Fibroid Awareness Month, a little bit more talk about fibroids. And so that's important because not only does it help us get closer to action and change, but it helps others feel like they are not alone in this and that their elected officials see them, care about them, and want to do something to make their lives better. This year, we're especially excited because there is legislation in Congress that would provide appropriations to the National Institute of Health for uterine fibroid research. But in addition, that legislation would provide for the Department of Health and Human Services to run a active and robust uterine fibroid public education campaign. So awareness is key. Awareness is the first step, but we're also moving towards action and research.
And of course, storytelling is a critical tool to our advocacy efforts. Our patient voices and our patient stories are at the forefront of this struggle and this movement, and they will continue to be at the forefront, and we will continue to be fighting and educating for change in this space.
And that brings us to our story. So how are we here? I got here after being diagnosed with fibroids about a little over 10 years ago. And when I was diagnosed, for reasons that could be a whole other presentation that we do, I really didn't hear much about it. Even talking to my mother, who I would later find out had fibroids, her statement to me was, girl, get some more fiber in your diet. you need to eat better, because I was having a lot of those symptoms that I would later learn are called bulk symptoms because of the size of the uterus, the frequent urination, constipation, feeling bloated, all of that. Now, fast forward to working with my physician, I was frequently told over and over again to watch and wait. And if you've gone through this journey or you're going to begin this journey, watching and waiting is a treatment option. It's a standard of care out there. And they tell you if the fibroids aren't bothering you, you don't bother them. The problem is they were bothering me. I was severely anemic. I was in pain a lot of times. I had the heavy bleeding. And so I really joined the White Dress Project because of that part of my story, because watching and waiting was actually very costly. So not only costly in that you're always going to the doctor, you've got ultrasounds every year, financial costs. There's also a cost to what your treatment option ultimately will be. By the time I got to my first surgery, I was so anemic that I was not a candidate to have all of my fibroids removed. They had to do the minimal surgery possible because it just wasn't safe to operate on someone with such a low hemoglobin. By the time I got to my second surgery, which was about a month ago, my fibroids were so large, I had to have that open abdominal myomectomy that Nkem just talked about, with 6 to 8 weeks off, the hospital stay, and everything else. So I joined the White Dress Project, and I share my story because I don't want any other person to have to make this decision, quite frankly, backed into a corner.
Thank you, Amber. I don't know if I'll have time to share my story because we just got some information that time's up. But I guess we can go to the question and answer. Thank you so much, everyone, again. So we have some questions. This is our information, by the way. You can go to Twitter, Instagram, Facebook, and email us if you have any questions and want to be connected. So we have a few questions. Which treatment preserves fertility? So the myomectomy, the laparoscopic, robotic, hysteroscopic, abdominal myomectomies, they usually are the fertility preserving treatments. Will not having had surgery to remove fibroids as suggested by your gynecologist lead to a gynecological cancer later on in life? I ask this not having had symptoms of fibroid problems or disease. I mean, we're like we said, we're not physicians, but I know that based on research, fibroids do not increase your risk for cancer. Mm-hmm. I don't know if you have anything to add to that, Amber.
Yeah, so actually one of our physicians, Dr. Chambers, said in one of the presentations that she's done with us, I think it was during a house call, that it's a rarity. Of course, there's always a chance, but it's a rare chance that it will lead to cancer because they are benign tumors.
Right. Question 3, what is your professional view on menopause and fibroids? I mean, I've heard that fibroids normally shrink or go away during menopause, but I know it's on a case-by-case basis. So that's something that a physician would better be able to answer better. Question 4, is it possible for fibroids to return years later? I had a UFE in 2012, 8 years ago, and I've never had any issues since then. I am concerned about it returning. I know that 50% of the time they do return within 2 years, but sometimes they don't return. So that is also on a case-by-case basis as well.
Mm-hmm. There is research out there that says that based on the number of fibroids that you had initially, that kind of may increase your chance. So women who had a lot of fibroids, they tend to grow back in them. They just don't know, unfortunately, there aren't enough answers as to why they grow. But there is some correlation there that we've heard of between the number of fibroids you have and then that risk of them returning.
Right. And the last question, oh no, that was the last question. Oh, sorry, that was the last question. Thank you so very much, everyone, for joining us today. Like I said, please reach out We will always answer. And thank you again, Rosalind and Black Health Matters, for giving us this opportunity, and of course, Myovant as well. Thank you all.